Hello, my name's Jenny Horrigan and I'm a specialist physio in pelvic health. This is the lowdown on pelvic floor exercises. Going to start in terms of technique, what to look for in terms of a good and a bad technique, and a few handy hints to help you along the way as well. First of all, where are our pelvic floor muscles? This is the pelvis. So you have the bony rim of the pelvis, and then inside, all the pinky bits here are our pelvic floor muscles. So they form the floor of our pelvis. They start off in an inverted dome shape, and when they work, they fold in on themselves. Yeah, and it's the ones around the back from the back passage that move up and forwards to provide the support. So when you think about the pelvic floor in terms of technique, if you start with the back passage, think about the back passage. If you're closing off from there, you're trying to control some wind, can't let it escape, so you're going to try and get that closing off the back passage. And then from there, pulling the back passage up and forwards towards the bony pubic bone at the front. That's one way to think about the action of our pelvic floor. Other things to think about are other areas or muscles that the pelvic floor coordinate with. First of all is breathing. It's important to breathe. Our pelvic floor coordinate with our diaphragm, which is our main breathing muscle. When we breathe in, the diaphragm flattens down, which will create pressure in the tummy and makes it a bit harder for the pelvic floor to work. When we breathe out, our diaphragm lifts up, which makes it easier for the pelvic floor to pull up as well. So if you can, try and work on doing your squeeze and lift up as you breathe out. And try and maintain your breathing as well. Try not to hold your breath as you do the exercise. If you hold your breath, that will create pressure in the tummy that will push down on those pelvic floor, certainly making it very hard work for them. And if the pressure you're creating is more than what your muscles can do without pulling up, you could be making matters worse as well. So keep breathing. Start breathing through your upper tummy first before we begin, and aim to do your squeeze and lift on the breath out. Once you've got the muscles on, then maintain your breathing as normal. Another factor along with that is your abdominal muscles, your tummy muscles. Now, the deepest layer of our tummy muscles are like a corset, and they do coordinate with the pelvic floor. So when you pull those pelvic floor muscles up and forwards, it's okay to feel a little bit of tension into the tummy, but you shouldn't be able to see anything from a distance. So as a rule of thumb, if you're doing them on a bus, apart from a bit of concentration on your face, nobody should be able to see anything moving anywhere. Okay, if you are, then you're perhaps overusing some other muscles as well, which could be making it harder work for you to have progress. So try and get that squeeze and lifting. You might feel a little bit of tension, but make sure you're not getting any bracing into your tummy, that your ribs aren't affected, they're not pulling down, or ribs kind of lifting up as you brace to do that pelvic floor. Another way that people often go wrong with them are overusing your bottom muscles, so try and keep those relaxed as well. So again, if you're moving up and down as you do your pelvic floor, that isn't right. Okay, got a few handy hints for you to try and help if you're struggling with this first technique. First of all is to think about your position that you're starting in. We need our pelvic floor when we're on our feet, we're lifting things, we're jumping, we're moving, but that might be too much of a challenge to start with for yours. So maybe make it easier. Consider lying down if sitting is too much. Lie down, maybe on your back, or even on your side can be a lot easier. If you lie on your side, you're nicely supported, the breathing's easier, you can see and feel a lot more what's happening in your tummy, and there's no gravity on the pelvic floor either. You could also try that one in pregnancy on your side, or perhaps in your falls position too, because it offloads the bump a little bit more. So think about your start position. Another thing will be your effort. Now, sometimes we try so hard to make a difference with these exercises that as well as working the pelvic floor, that's when all the other muscles join in, which can make matters worse. So if you find that you are overusing the rest of your tummy, if you're getting your bottom muscles joining in, try and reduce your effort about 50% of what you were doing. So you're getting your pelvic floor, but stopping short of everything else joining in as well. Okay, and gradually as you can isolate your pelvic floor, learn which is your pelvic floor, you can gradually increase your effort, but without getting too much of everything else as well. Another handy hint for you is with the bottom muscles, if those are overworking and up and down, or your legs are working, you could try contract relax first. So what this means is that before you start your pelvic floor, you're going to squeeze your bottom and leg muscles as hard as you can, and then relax them. Keep those relaxed and find a different sensation, more in the middle, a little bit deeper in, and see if you can find that pelvic floor and relax. And you don't have to do that every time. So you squeeze your bottom, relax, keep it relaxed. Think more in the middle to find that pelvic floor up and forwards and hold that. Okay, so just a few handy hints to try and help you. But there are times that doing pelvic floor exercises, particularly with an incorrect technique, could be making it worse. So if when you do the exercises you get pain anywhere, then stop them. If it causes you to leak when you do your pelvic floor, makes you feel like you need a wee, makes you feel sick or dizzy, or if when you do your exercises it gives you like a heaviness, a pressure down below, or makes any of your symptoms worse, then do stop. An incorrect technique can sometimes make your pelvic floor problems worse if the pressure you're creating is overloading them. Sometimes what can also happen is you can have a tight pelvic floor. So it's not always about having a weak pelvic floor, it's about those muscles not functioning properly. So they should be relaxed, and when we need them, when we try and pull them in, they move up and forward to the pubic bone and back down again and release. But what can happen is those muscles can actually be working too hard to start with. So it means then that they become tired, they can become painful, they're not relaxing down properly. But it also means when you need them, they're also not pulling up properly either, so they're not functioning well. And if that's the case, it isn't just about trying to do pelvic floor exercises. You need to learn how to relax those muscles first. And the breathing can help with that and coordinating, finding that technique. But if you struggle with that technique and you think, I can't feel anything working, not sure what I'm doing, or you're getting any pain, leakage, any of these things I've discussed, then do stop your pelvic floor and seek expert advice. There's pelvic health physios like myself throughout the country that you can find through the POGP, the Pelvic Obstetric Gynecological Physiotherapy website, or through the Squeezy app as well. So do seek help to try and give you a little bit more guidance of what's actually happening with that muscles if you're struggling. Normally what I'd expect, if you're getting the right muscles working, you should be feeling progress with your technique within those 6 weeks, not necessarily changing your symptoms, but feeling that the muscles are getting stronger and the exercise is becoming a bit easier, maybe just tuning into those muscles a little bit more within 6 to 8 weeks. Again, if you're not really feeling that progress, then you should be getting some extra help. Okay, well, I hope that was useful in terms of the technique. So the next thing we need to look at is also dosage, how much to do to make a difference as well.